Welcome, everyone. I am so happy to have a special guest join me today. This is Dr. Drew Christensen, and he is a functional medicine doctor. And I have had a wonderful opportunity to talk with him a few times and learn more about his practice. He has recently moved to Park City, Utah from Arizona and opened up a practice here. And I'm so excited that we have his resource that I really wanted to share him with you today. And we're going to talk about some really, really valuable insights that you can use for your health. At this time of year, we're going to talk a little bit about allergies and digestive health. But we're also going to give you an idea of what things as a functional medicine doctor and an integrative and holistic medicine physician that he has that really make him stand apart from maybe just your regular family practice doctor down the street. So welcome, Dr. Christensen, to the program today.
Thanks. It's good to be here. Appreciate you taking the time.
You're welcome. So just a little bit more background about him. He started out his medical practice working as an obstetrician, and then later on he had some of his own health problems, and he was really only able to find answers for them using more of a holistic and natural approach. And that really kind of changed his medical career and gave him a new perspective. And so he went and became board certified in integrative and holistic medicine and started working a little more of those natural remedies and lifestyle changes into his practice. And then he found that that was a little bit harder than he expected it to be, to integrate those two. So he went on for more training into functional medicine and has now really used that as the basis for his practice. Tell us a little bit more about why you find functional medicine and integrative and holistic medicine so helpful to you as you work with patients.
Great. I'd love to talk to that. First, I'd like to just clarify a little bit on my story. My time in OB was very brief, and I moved into family medicine, and great experience working with great doctors and great patients. And then when I got sick, I just found that those therapies I was using for all my patients weren't working for me. And so really discovering alternative medicine and functional medicine really turned that around. And what I found through that experience was really a contrast between what we call allopathic medicine, which is the way I was trained, and functional medicine, which is the way that I'm practicing now. And really the difference is I like to refer to it as the medicine of what versus the medicine of why. And right now when we go to our doctors, the doctor's job is to figure out what you have, what diagnosis or what's causing your problems. And once that diagnosis is figured out, then the doctor's job is to find out what treatment will match that diagnosis. And so really it's a matter of figuring out what you have and what treatment goes along with that diagnosis. Functional medicine is different because it's really, when someone comes in, we not only ask, what is it that you have, but we ask why. Why do you have it? What is it about your story, your background, your exposures, your genetics, your diet, your lifestyle that's brought you to this point? And what can we do to really turn it around? And so it's really that medicine of why, getting down to the root cause. And I like to say, instead of treating disease, we're really focusing on creating health. and
I love
and
that.
that's really what it's all about. And so really someone who's super sick can benefit from this, but also someone who thinks they're well. There's always a way to create more health. And so that's really kind of the difference I see between allopathic medicine and functional medicine.
I love that. That's a beautiful description. One of the things that's been on my mind a lot is that sometimes our bodies just don't have enough indicator lights in them, right? We have our car and we have a check engine light that goes on, or we have, all of these little, you're out of gas and this meter and that meter. And sometimes I think that we just don't have such obvious signs in our own bodies. So we can be on a pathway that isn't creating more health. It's actually leading toward disease down the way. But, and maybe we'll have little symptoms like brain fog or headaches or indigestion or, diarrhea or some other things that maybe we just let, oh, that's weird, but we ignore it. And our body's trying to tell us that we really aren't healthy, and yet we go to the doctor and they run some tests and they go, well, your cholesterol's fine, your blood sugar's fine, you're good to go. If they don't have a diagnosis yet that's really clear, there's nothing they can do for us. But that's totally different than saying, you know what, you are not giving the tools your body needs, the building blocks to create health in the future. Instead, you're bombarding your body with, foods that are less nutritious or environmental toxins or whatnot. And that ultimately is leading to disease. So
Yeah.
sounds like in your practice, you could look at someone's lifestyle and say, you know what, you might feel pretty good except for this one little issue, but let's focus on really setting a good foundation for health so that you can avoid having an autoimmune disease pop up in the future, or diabetes, or will protect your heart for the future.
Yeah, exactly. I love your analogy about the car, because it's very much like driving down the road and you feel like your car's doing great. None of those lights that you talked about are coming on. And then you go to change lanes and lo and behold, you end up knocking into the car next to you because you have a blind spot. And a lot of us are driving without checking our blind spots. And there's a lot of ways to check those blind spots. Sometimes looking at laboratory values, different laboratory values, or looking at the labs that your doctor has already drawn and looking at them through different eyes. Sometimes we can see those blind spots. The other thing that I see a lot of is, people feel good even though they're eating a crummy diet, and so they feel like things are okay. And what happens is the body is dealing with that crummy food. It's kind of like the body's employing this security system to take care of all that crummy food or infections or whatever things we're getting exposed to. But what happens over time, just like if you have this beautiful home and you have a security system, but you keep seeing all these crummy guys in the neighborhood, and so you're needing to hire a security guard or maybe a bodyguard, and all of a sudden, before long, you've used up all of your budget on security, and then all of a sudden the maintenance of your home starts going down and your home starts falling apart because you've spent your whole budget on security.
That's a
And
great
that's
analogy. I like that.
that's really what happens with our bodies, is that we may be tolerating those things now, but over time we're going to use up too much of our budget fighting those things off, and then other things are going to surface because we haven't been maintaining our bodies like we need to, just like we need to maintain our homes.
Yes, absolutely. Can you tell us a little bit about some of the most useful tests that you use in your practice that can really help us find those blind spots in our health?
Sure. So the number one tool for me is your story. And we go through someone's story from before they were born. So when mom was pregnant with them, we want to know everything about that pregnancy, your childhood, your adolescence, your entire life, the events in your life, marriages, divorces, traumatic events, illnesses, great things that have happened in your life. And it's what we find is that in our stories, there are clues that really tell us a lot about a person. And so the story is really the number one thing where we find a lot of blind spots and a lot of reasons why people are sick. And then from there, then we decide what laboratories we need to be looking into. And we can look into hormones, we can look into heart health, we look for inflammatory markers, we can look at, digestive issues, but really we can do just very simple blood work and find a lot of blind spots. Like most people that come into my office have problems handling sugar. And we can see that early on in their blood work. And often it's blood work that's already been done by their doctors. And so we can see people that are kind of getting in line to climb on the diabetes bus, for example, and we can, help them get out of line and choose a much better road to go down. And so,
what kind of symptoms would someone be experiencing if they are having issues with their blood sugar, but they're not a full-blown diabetic, or maybe not even officially pre-diabetic yet? How would they be feeling?
So some people feel great, and we find these things, but subtle things are things like you get really tired after you eat a big meal, or you feel like your energy drops and you eat, and all of a sudden your energy's back after you eat. Those can be very subtle signs that you're having some blood sugar regulation issues. And the labs that we look at are things like your sugar level, but we also look at insulin levels. We also look at triglyceride levels. And the insulin level can be an early clue, and that's something that most doctors aren't looking at.
That's true. Yeah. I think that's a big one. Blood sugar is so underrated in our society. I think people just really don't understand the roller coaster they put their body on when they eat so much sugar at one time, and it's so common. You go to a function and you'll have a brownie and a glass of soda, and you ate French bread for dinner, and suddenly your blood sugar is up in the high 200s and you don't even know it.
Yeah, so in our society, we've known about diabetes for decades, centuries, and just since I've been a physician, there's been introduction to multiple medicines to help manage diabetes, and yet diabetes continues to climb. And in fact, now they're calling Alzheimer's disease type 3 diabetes because there's a big tie between blood sugar dysregulation and problems with our brain, and can actually lead to Alzheimer's disease.
Wow.
And so, yeah, sugar's a really big issue. And there's lots of other blind spots besides sugar. Most diseases, chronic diseases, are more of a spectrum, meaning that they start off early and over time they develop and they get worse over time. And a lot of times in medicine, we don't make the diagnosis till it's down the road and it's already progressed. And so if we can find things, if we can find them early, then we can really prevent them from progressing and sometimes turn them around. That's super true with like autoimmune disease. You can find those early or find clues that they might be developing. So really important for people to get in, even if they feel like their health is good.
I agree. I think we have that concept finally in our heads as a society for cancer, right? We understand we need to have colonoscopies and breast cancer screenings and things like that. We understand that those tumors can be growing and we don't feel them yet, and if we can catch them early. But I think we're still getting our heads wrapped around the idea that that's true for every disease, that autoimmune diseases and diabetes and heart disease, that we're just not going to feel it when those diseases are starting and when they're the easiest to turn around. And so we really do need some outside help to find those things earlier.
Yep. Super important.
Definitely. Let me see, what else do I want to make sure we cover today? Let's talk a little bit about allergies. Let's get into that.
Okay.
How do you approach allergies? Is it just a histamine reaction, or is there some of these underlying things going on that you look for?
So what I've really found with my allergy patients is that, so when someone is having a lot of allergic symptoms, it's basically the immune system is responding to whatever it is that they are allergic to, whether it's pollen or food or something else. And is what I have found is that in general, if we can get the immune system to calm down, that just by getting the immune system to better behave, that allergies will in turn get better. So I've had patients with severe allergies and asthma that really are able to get off all of their medicines just by going through a process of getting their immune system to calm down. And that's really about getting their gut and their digestive system in line, because our immune system is intimately linked to our digestive system. And so if we can get people's digestion working really well, get them eating really good, healthy food, sleeping at night, doing those basic things for their health, a lot of times their allergic responses go from being really reactive to just being very minor responses. And so that's a huge thing that I found with my patients with allergies.
So would you say allergies might be one of those indicator lights? that it's not just about the pollen in the atmosphere, but it might be a signal about how your immune system state of health is in general?
Absolutely. Yeah. Yeah. So in a way, certainly those allergic responses can be very deep-seated, and they need to be sometimes treated. But also sometimes they can just be clues that there's other underlying imbalances that if we address those, then a lot of times those allergic responses are not as severe.
Right. Yes, that makes sense.
But you're right, it is normally a histamine type reaction. We have cells in our body called mast cells that can release all these chemicals that can give us those reactions. And so some of my patients that continue to react, we can, around allergy season, we can get them on some things that help calm those things down, things like vitamin C, quercetin, something called nettles, can all help calm those responses down. But probably the biggest thing that really helps is really just addressing all those other underlying imbalances.
Yeah, especially gut health. It's just so
Yep.
essential. If you have intestinal permeability or leaky gut and you have proteins getting through into your
Yep.
blood, you're going to be on high alert with your immune system.
Absolutely.
Which leads me right into my next question. So, with the gut health, we're really learning more about the microbiome and how we need our friendly bacteria and things like that for gut health. But one of the things that gets overlooked a lot is digestion starts in the stomach. And if our stomach acid isn't balanced right, if we have, really high levels of acid, or we're on proton pump inhibitors and other things, or maybe if our stomach acid is too low and our proteins aren't getting broken down from there, our intestines or our gut, especially our large intestine, are going to have a much more difficult time with their job. So many of us in our society are dealing with acid reflux and other things. What can they do to balance that out from your perspective?
Yeah, so it is a big, huge problem. The marketing efforts for those medicines have been really effective. You've got the purple pill that you can take to treat your reflux or your heartburn, and you're absolutely right. Mother Nature created us with acid in our stomachs, and that acid is really crucial for a number of things. One, it helps you, as you mentioned, to digest proteins. It also helps to kill some of the bad bacteria that we're exposed to. The other thing that the acid does is it helps stimulate the pancreas, which then releases enzymes which help us with digestion. So if we're taking acid blockers, antacids, or proton pump inhibitors, which is that purple pill, then we're stopping all of that acid. And so what happens is we get undigested proteins that are moving down into the intestines. We're getting bacteria that maybe shouldn't be there moving down into the intestines. We're not getting that enzyme from the pancreas to help digest the food. And so all of that material moving down into the intestines will cause inflammation, will cause the lining of the gut, instead of being a barrier, it will become leaky and stuff will start leaking through. And what we also see very commonly is that we get an imbalance in the bacteria in the small intestine, which very commonly will lead to a condition that we call SIBO, which is small intestinal bacterial overgrowth. And then that can lead to a whole other number of imbalances. And so a lot of my patients have been on those treatments for years. And so to get them off of those proton pump inhibitors or antacids can be a very slow and deliberate process. If you stop them cold turkey, it usually doesn't go well. So it's usually a slow process of transitioning them off, and we can actually give our patients, when there's no acid in the stomach, we call that achlorhydria. That's the medical term for it. And we can actually give patients acid treatments. We can treat them with hydrochloric acid, or even just apple cider vinegar is a good way to put some acid into the stomach and to help with that digestion. But it's something they have to do very carefully. And in some instances, there's studies that need to be done where you actually go in and measure how acidic the stomach is and things like that. But most of the time, I find that patients actually do better without proton pump inhibitors. So we will try and get them off, try to replace that acid in the meantime while they're making that transition. But it's a huge, huge problem because people don't really see any harm in taking those pills to help their heartburn.
Mm-hmm. Yeah, it really does act like a domino as it, those effects
Yep.
go down through your entire digestive system.
Yeah. Yeah, and when your gut's not working, then as we discussed before, your immune system's going to be dysregulated. The other thing is there's a strong connection between your digestive system and your nervous system and your brain. And so when your gut's not working, your brain's not going to be working either. So.
And your mental health.
Yep.
Your anxiety, your brain fog, your even certain types of depression, and just all kinds of things. We just think, oh, it's just our stomach. Who knows?
Yep.
Everything's connected.
It's all connected. It's a giant web.
Yes, indeed. It really is. Now, you have some really powerful tools in your office as well. Tell us a little bit about your neurofeedback machine and your hyperbaric oxygen.
Yeah, great. So the neurofeedback has been a wonderful tool. We use something called Clarity neurofeedback. And it's really great for helping people with anxiety, depression, brain trauma, post-traumatic stress problems. Can help with helps with ADD and other brain related problems. And is what I really like about it is a lot of the work that we do is helping people change their lifestyles, and that's hard work. It's challenging, right? But the neurofeedback is something that they don't have to work hard at. They just come in and we set them up. The treatment lasts, 10 to 30 minutes, and we're done. And it basically just helps the brain reboot and use a different pattern. Our brains get stuck in certain patterns. I always describe it as, when I drive to work, I usually go the same way every day. My brain's used to doing that, and it's just a set pattern in my brain. But there might be a quicker way to get to work, or there might be a more beautiful or enjoyable way to get to work. And my brain is just set in this pattern right now. So what the neurofeedback does is it helps the brain see those new patterns and new ways of doing things. So it's really great at helping people kind of get out of those stuck patterns and overcome some of those problems with depression, anxiety, and other issues. So it's been a really great tool. And then the hyperbaric oxygen is really great. Our oxygen is what's needed for our bodies to produce energy. And so if we're able to deliver that oxygen in a more effective way, then the body's able to produce more energy and perform better. And so hyperbaric oxygen is great for brain-related issues like brain traumas and brain-related illnesses like Alzheimer's disease, Parkinson's disease, things like that. It's really great. The other thing it's super good for is wound healing. So it can help wounds heal much quicker. And I find that when I come out of the chamber, that I'm just more alert and my brain's just working better.
Almost like you've gone for a brisk walk and got your oxygen flowing. And
yeah, it's pretty amazing. It's really good too for people that come to our area of the country and they're used to being at sea level, and they get sick because of the altitude. The hyperbaric oxygen's really good at helping them get over that. So it's super great.
Curiosity, how many sessions in the chamber would someone need to help them with that altitude adjustment?
For altitude adjustment, just 1 or 2 treatments is really all they need. For some of these other chronic conditions, we need more treatments for the effects to be more lasting.
Of course, yes.
Yeah.
I've heard recently that they're having good success with hyperbaric oxygen and autism. Have you seen that?
My partner here in the clinic has treated some kids with autism with a hyperbaric oxygen and has seen some results. And I'm not familiar with all the studies in that area, but yeah, there are some testimonials in our clinic of it working quite well.
Yeah, well, there again, it's increasing the oxygen to the brain and other areas of the body too, that in autism, a lot of it is based out of gut health and detoxification pathways and other things that need extra boost.
Yeah, and that's really the case with most chronic diseases, is that they're multifactorial, meaning that there's lots of things going on that are contributing. And, in allopathic medicine, we're really good at treating acute disease. We're really good at treating infections. And really, if you look at infectious disease over the last 50 years, it's gone way down because of the effective treatments. But chronic disease has gone the opposite. It's gone up. And for a long time, we've been looking for the one solution for each disease state. And there's just really not one pill that's going to solve chronic disease, because there's multiple things that contribute to it. And so it's really, you have to put on your Sherlock Holmes hat and be a detective and find all those things that are contributing, and then address all those little dysfunctions so that we can get the body functioning how it's supposed to.
Exactly. Which I think really speaks to why it's so important to do the lifestyle things that we know we should do, whether it's eating healthy or exercising or getting enough sleep. Oh my, that one is so underrated, because our body is all connected. And even though we might be focused on one area of pain, doing those things will just elevate our health and prevent disease of all kinds.
Yep, it's huge. The lifestyle is huge, and that's why the work that you do is so important. Helping people to change is really the business that we're in, right? And really helping people to achieve their potential so that they can give the gifts that they were meant to give. That's, everybody's put on this earth to do something great, and health gets in the way. And so if we can help people change their health, then really they can do anything. I found that if people can really create health, then they can create anything in their life.
That was so beautifully said. I couldn't agree more. So very, very true. Well, I think that's a perfect note to end our interview today. But I wanted to check with you and see if there was anything else you wanted to share today.
I don't think so. I appreciate the time, and it's been great to have this little talk. And let me know if there's anything else you need or would like to learn about.
Absolutely. And can you tell our listeners today, how can they reach you if they want to find out more?
Great. So our clinic here in Park City is called Living Health Functional Medicine, and they can find us online at livinghealthmd.com, and they can call us here at the office. Our number is 435-214-7282.
And I wanted to mention too that one of the reasons I like Dr. Christensen is he does a lot of his work remotely as well. So when you work with him, you won't have to drive into Park City every single time if you don't live in that area. One or two individual visits, and then my understanding is you can do a lot over the internet as well. Or
we have telemedicine set up, and we can take care of people that are remote. A lot of our patients don't live close by, and so we like to see them at least once here in the office, but then most of our follow-ups can be through telemedicine, just kind of like you and I are having this discussion today. That's similar to how our visits go.
Exactly, and I definitely wanted people to know that, because that is so valuable, especially for those of us who live a little more rural areas. All right, well, thank you again so much.
Hey, thank you. Take care.
Bye.
Bye-bye.